Hi, my name is Marco Joseph. I am a house doctor and I'm currently pursuing a postgraduate diploma in endocrinology. You are watching this video because you've probably been diagnosed with pheochromocytoma, or you know someone that has been diagnosed with pheochromocytoma and you'd like more information. So what is pheochromocytoma? This is a rare condition. It's called an endocrine tumor. And what happens is you have a small gland, which is called an adrenal gland, that is found on top of your kidney. In normal circumstances, this gland produces hormones which are essential for life. However, in someone with pheochromocytoma, this gland produces hormones at an abnormal rate. I will take you through some symptoms that you might have experienced. These symptoms are as follows. You probably started having headaches, which are uncontrolled. And this is probably the first time you've been experiencing these headaches. In addition to that, you started being more aware of your heartbeat. Even when you are seated and you're not doing any exercises, you feel that your heart is beating very fast. This is called palpitations. You might have also experienced feeling sweaty, sweating up inappropriately. You know, when you are relaxed, you're at rest. And because you were worried about this, you went to see a doctor. And what this doctor did was probably measured your blood pressures. And your blood pressures were quite elevated, which according to you is quite unusual. Because you've gone to see this doctor, they had run some bloods to make sure that you don't have causes of what we call secondary hypertension. And this is when your blood pressure is elevated due to other diseases. Pheochromocytoma is definitely on the list. Other things can be abnormalities with your thyroid gland and also abnormalities with your kidney. Now, when he would investigate you for pheochromocytoma, he probably gave you a big bottle to take home and collect your urine for 24 hours. And this he used to measure fragments or breakdown products of the hormones that are released by this abnormal tissue in your adrenals, which is your pheochromocytoma. They probably also took blood samples to measure hormone levels in your blood. And these are usually called the metanephrines, which are breakdown products of hormones that are released by your adrenal glands. And once your results were out and it was shown that these hormones are elevated and it most likely points to pheochromocytoma, they probably requested for scans, and you had to put on a suit or change your clothes and go in what seemed to be a donut shaped scan, and this is called a CT scan. Alternatively, they could also do MRI. This is really to find the location of this pheochromocytoma so they can plan your management. After these scans, they can comfortably make a diagnosis of a pheochromocytoma and tell you precisely where it is located. And I'm sure by this time you were worried. But all is not lost, because the best treatment method for pheochromocytoma is surgical removal of this mass if it is detected early. And this surgical is usually curative. However, before the surgery starts, at least the night or a few days before the surgery is due, the anesthetist, which is the doctor that is responsible to make sure that you do not feel anything during the surgery, will come and prescribe some medication for you to ensure that all hormones that are being released by this tumor are dormant and they will not affect the surgical process. Because with manipulation of this tumor, it will result in releasing more hormones, which will then have a complication. Your blood pressures will be elevated and will be very difficult to control during the surgery. So to ensure that this does not happen, the anesthetist will come the night before, a few days before the operation is due, and prescribe you 2 medications that will block the receptors to which these hormones are supposed to touch. This will ensure that you have a safe surgery. Once the operation has been completed, they will continue to monitor your hormone levels to ensure that they have completely removed the tumor and to ensure that it has not returned. This will probably continue for about 15 years or most of your life. Unfortunately, there has been 3 conditions, or rather 4 conditions, that have been associated with this tumor, and it's important for you to have your family investigated for this. This investigation will include some genetic testing to make sure they don't have the same tumor or any other tumors or tumor-like conditions that are associated with pheochromocytoma. Remember that healing always starts with your mindset. Always keep a positive attitude, accept the diagnosis, and have a discussion with your doctor to ensure that all the questions that you have and anything that you're uncomfortable with before the surgery, we have discussed these.